everyone. Thank you so much for joining us. Believe it or not, 1 in 10 people will experience an anal fissure in their lifetime. An anal fissure is a small tear or crack in the lining of the anal canal, typically caused by trauma such as passing hard stools or prolonged diarrhea. This painful condition is far more common than most realize, and yet so many suffer in silence, too embarrassed to seek for help or even talk about it. That's why we're so glad to chat on IG Live today, once again with Dr. Carmen Fong. Dr. Fong is the co-medical director of Hemorrhoid Centers of America and double board certified general and colorectal surgeon. During this live, we're going to discuss common causes of anal fissures, ways to make bowel movement less painful, and when it's time for surgery, and so much more. I saw Dr. Fong. It happens.
How are you?
Good. Thank you so much for taking the time to join us again.
Of course, yeah. No, I'm excited to be here.
So so for those who didn't really see our first live, just remind everyone and also tell us a little bit about yourself, like how you became a double board certified general and colorectal surgeon.
Right, all right. Yep, so I'm Carmen Fong. I was born in Hong Kong and then we immigrated to Canada when I was 5 years old. The 30-second spiel is that we then moved to Connecticut and then moved back to Hong Kong where I graduated high school. And then eventually I went back to college at Sarah Lawrence College in New York, in Bronxville, New York. And then I went to medical school at Michigan State University. After that, I wanted to do surgery instead of medicine, instead of internal medicine. And so I did my residency in New York City at Beth Israel Medical Center. After a 5-year surgery residency, you have to decide whether or not or what kind of surgeon you want to be. You can be a general surgeon or you can subspecialize. I decided to do colorectal instead of plastic surgery, like to my parents' chagrin every day. And so because it was, it was something I really loved to do. I wanted to do like be master of the abdomen and colorectal diseases, the guts and the butts and stuff like that. So because of that, I have to be board certified in both colorectal surgery and general surgery. And right now, my practice actually mostly specializes in anorectal diseases. So hemorrhoids, fissures, fistulas, this is like my bread and butter every day. And yeah, but thanks for having me introduce myself.
I love it. I love hearing that story every single time, and especially like why you pick colorectal over plastics, plastic surgery. I just love it.
And it never gets old because my parents are still like, oh, you could have been a plastic surgeon. And I'm like, I guess so. But I feel like I help a lot of people this way in a specialty that's not very well known in conditions that people don't like to talk about. And I have the right kind of personality to kind of talk about it.
I love it. I love it. I love it. So like in the beginning of this live, I kind of gave a quick explanation of anal fissure, but could you explain to our viewers like what they are, what? Oh, looks like we have a glitch in connection.
I can hear you.
Hopefully it'll come back. Okay, now you're back.
Oh, okay.
It could be my internet. We have a storm here today.
Oh yeah, no. I could hear you, so I'll sure. So anal fissures are, I usually explain it as a cut in the anoderm or the anal skin. And they're usually deeper than like a superficial tear that you might get from like wiping or something. And most commonly it's in the posterior midline, so near your tailbone area, although you can also get them kind of anterior in that space between either your vagina or your rectum or your prostate and your rectum. And the causes of it are very similar to the causes of hemorrhoids, which is, frequent sitting, constipation or diarrhea, sitting and straining on the toilet. But in fissures, there's a little bit of an extra condition, which is that it can be caused by stress. And so lately, and what by lately, I say since COVID, I've seen a lot more fissures. It's very common in young people. because we were all, working during the pandemic, sitting at home, working remotely for like 8 hours a day, which we talked about last time. But then also like the stress doesn't help. And so for some reason, especially young women, we're taught to hold our stress in our pelvis. So literally we walk around with our buttholes like this, trying not to poop. Maybe not for you and I, but for like everybody else, trying not to
Oh my
poop
God.
all day. And over time, this becomes like a spasm where if this was your butthole, it's actually squeezing too tight and it has forgotten how to relax. And then the other pathophysiology of anal fissures, which I've always found like super interesting because you don't really consider this, is that so if, for example, this is kind of your anal sphincter, and this is the fissure where my finger creases, it's actually squeezing too tight, so there's no blood flow going to there. It's all white around it. And so what any kind of treatment, hopes to do is actually relax that muscle, pink it up so that it can actually heal. And the blood flow goes back to it. Ointments, topical ointments help with that. Traditionally, I think you go into this later on in the live, but traditionally it was called a lateral internal sphincterotomy, where we would actually have to cut the entire muscle and release it so that it can heal. But these days there's a lot of other options before we have to do the cut. The cut works, but there's also the side effects of like, a low risk of incontinence or an infection.
So how do like the fissures different from hemorrhoids?
Yeah. So we actually see so many fissures, and I think it's actually one of the most commonly misdiagnosed things because people tend to be like, "Oh, I have pain in my butt. It must be a hemorrhoid." But hemorrhoids tend to not hurt as much unless you have an external hemorrhoid. But fissures can be like a sharp paper cut pain. So sharp paper cut pain and bleeding, but like it could be drops of blood in the toilet bowl or drops of blood on the toilet paper. That's usually a fissure. Like a dull, achy pain, or even just like a throbbing or pressure or burning, that is usually a hemorrhoid. I have had tons of patients who, have like somehow like a, like higher pain tolerance. And so they don't experience pain as like sharp, but more like a burning or itching. That is possible, like a common presentation too.
So could people could also have both fissure and hemorrhoid at the same time?
100%, yeah. And actually, it's super common. And sometimes I call it the trifecta, which is hemorrhoids, fissure, and pruritus ani, like itchy anus, because of all of those things are happening at once. And what happens is that if you have a lot of hemorrhoidal swelling and pressure, you have a fissure. This is the hemorrhoids, and you have the fissure kind of in between them. Um, Even though you can use all these topical ointments, it doesn't really heal until you can kind of also reduce the pressure of the hemorrhoid so that it can close rather than remaining open. So yes, you can have a fissure between hemorrhoids.
I
Yeah.
I could also imagine like, if you actually have that problem and then when you're trying to poop or passing a hard stool, you could open up the fissure or touching
Exactly.
the hemorrhoid,
Exactly.
and then you might not be able to wipe it clean, and then you get itchy anus, right? Like all of the trifecta.
Exactly. You have it like right on the nose, which is what kind of the cycle of what happens is that you kind of have that tear when you have a hard poop or even diarrhea, you're wiping too often. And that tear, like any skin tear, as it heals, it actually starts to itch, right? And so people are like, "Oh, I have an itchy butt, it must be dirty." And then so they try to wipe it or clean it with more soap and washcloth.
Made it worse.
And then yes, it makes it worse.
I
So I'm like, don't do anything. Stop doing anything.
So you mentioned a common cause like stress is a major one. And then last time we talked about like some of the issue with hemorrhoids is not having enough fiber and water. Are there any other common causes of anal fissure?
So again, most of the causes are the same, and so the only one that's different is stress. But
Oh,
increasing fiber and water intake does help with fissures as well. Because if you can imagine, like a softer stool passing through will not tear that fissure apart every time. On the other hand, I also kind of advise people like um, one of the main things with fissures is that once it tears, it's difficult to heal. And so you can have that sharp pain in the morning and then an achiness that lasts for like hours after. So it's like super terrible and debilitating. And again, like, a common reason people come to see me because like, they can deal with a little bit of bleeding, but pain for hours is worse. Is that you should not try to not poop though. Because if you don't poop, right, and try to hold it in, A, it makes that spasm worse, but B, you actually want some of like the natural stretching that poop does. And so if you keep your poop too small, it actually scars down your anus to like a smaller hole so that you're ripping every time again. You want it to be like a normal size, healthy bowel movement.
Ah, it makes so much sense after you explain it. It makes so much sense.
Literally, I spend like hours like reading and thinking about this all day, and it's like, yeah, but like people tell me, well, I'm trying not to poop or like have really tiny poops, and then the fissure doesn't heal because then you have it like a big normal poop again, and it rips. And I'm like, okay, so you
Duh.
can't, which is a real,
I can't hear. Okay, now I can hear you again.
oh, sorry, I was just saying like, which is a reason you can't be on Miralax like forever and just have only liquid stools.
Are there any like risk factors make some people more prone to developing anal fissures?
Uh, that's a good question. So technically, fissures are more common in women. So like stress and the sitting for long periods of time. There's a secondary cause of fissures, which is like superficial tears. So you can have tears during childbirth, which causes scar tissue that, like, again, is kind of weaker afterwards, so can tear more easily. And then I've actually had this question on TikTok recently, which is like if low estrogen can cause fissures. So real answer, the short answer is no, because it's not causing the type of fissure that we're talking about. But low estrogen can cause thinning of the skin in the vaginal, perianal, and perineal areas, and that causes like superficial, like shallow tears, which can be also described as fissures. But again, not the same type of fissure that we're talking about.
So then when people experiencing fissure, and then we mentioned like, it could affect the bowel movement. So how can they, make it less painful?
Yeah. So usually if you see like a colorectal surgeon or even a GI, they will prescribe you a compound ointment, and that's usually the first. Okay. That's usually the first medicated step, which is that an ointment that relaxes the smooth muscle so that the muscle can relax and then the fissure can heal over time. If you're, struggling before you can get to a doctor, and this is common because people don't know what they're dealing with, I would say the first things are do a warm bath. So not a sitz bath in the bathtub, in the plastic tub thing, but in an actual bathtub, like 10 to 15 minutes, warm water, because you're relaxing the muscle. Sit on an electric heating pad for 10 to 15 minutes or while you're watching TV. So anything that kind of relaxes muscle contractions will work the same as in your pelvis. Because what you're dealing with after the fissure is the underlying muscle spasm. So you're trying to do anything that will relax the muscle. And then using a topical lidocaine or even just kind of like a gentle lubrication like Vaseline. So when you apply it on the fissure or aquaphor, and it numbs it, gently relaxes that sphincter, so then you can have a smoother bowel movement. And you can apply before and after a bowel movement before you get a medicated compound.
That's a good tip. And that's easy
Yeah,
to do.
exactly. You can do it's easy to do, lidocaine or aquaphor, a little bit of lubrication. Some people will try a glycerin suppository, which again is good for lubrication. And I think maybe we talked about this last time or not, but the one thing you should not do is use preparation H suppositories and or like a hydrocortisone suppository, because those already thin the skin. And so if you're putting that on top of a space that, you know, already needs more blood flow and healing, it's actually gonna make your fissures worse. Yeah.
And are there any like long-term effects of chronic anal fissures?
Uh, no, it doesn't. As far as we know, it doesn't turn into cancer or anything like that. You can have a chronic wound that has abnormal cells grow into it. Again, dysplasia, that's pretty rare. The main thing I would say is that it's very painful. Like I've had people deal with fissures for like a year or 2 years, and it's to the point where people are like, I don't want to have a bowel movement, I don't want to go out. Like, the pain is the worst part. There's no long-term like fecal incontinence risk or anything like that. You can have like pretty bad scarring and then eventually like some pelvic floor dysfunction because you're like holding muscle tight all the time. But at least it doesn't turn into cancer.
That's good. That's
Yeah.
good. And how are anal fissures diagnosed?
Usually by clinical exam. So, and it does have to be either a digital rectal exam or an anoscopy. It's difficult to diagnose just by looking at the outside, which is, what some providers will do. And or with the colonoscopy is almost impossible. So people are always like, oh, why can't you see a fissure on colonoscopy? But when you stick a colonoscope in, you're going like right past the anus and right up into the rectum. So, and even when so you can do like a retroflex to look back downwards on top of the internal hemorrhoids, but usually it's covering the area where the fissure is. So it has to be, I have to be looking at it. Usually if I just open up the anus a little bit, you can already see the beginnings of it. And then via an anoscope, you can definitely see like the internal portions of it.
So it sounds like it could also be the fissure itself could be pretty long too.
Yes, they can be like an inch or two, like extending from the internal sphincter, which is like the pathology of it, to the outside. And the telltale sign sometimes is called a sentinel pile. So literally like a tiny little skin tag, like a flesh-colored skin tag. And that's just a pile of scar tissue that grows there because as your fissure breaks and heals, it's trying to pile up this scar tissue to heal itself. And a chronic fissure will have a sentinel pile there. So as soon as you see it, you're like, oh, that's a fissure. People do mistake it for hemorrhoids, but that doesn't have like a blood vessel component. So it's not a true hemorrhoid. It's actually a sentinel pile. The one other thing we sometimes do to diagnose, not fissure itself, but chronic anal spasm is doing anal manometry. So testing for your anal sphincter pressure and the nerve function. So if you have like a super spasm, the numbers will be off the charts, and that will be another way to know that you have a spasm that could be causing off and on acute on chronic anal fissure.
So you mentioned that some of the treatment option first, if you don't get to a doctor, use
Yeah.
Vaseline, use glycerin, use the warm bath. Like, what about other other treatments?
Yeah. So one of the most kind of like popular treatments right now, and the one that I do the most, is Botox. So Botox in the internal anal sphincter works very well. The latest studies were like over 85% of people actually heal from it. So the same stuff that you do in your wrinkles that relaxes the wrinkles actually relaxes your anal sphincter, right? So it relaxes the muscle spasm. And over the next 3 to 6 months, for like the longevity of the Botox in your body, you're allowing the fissure to heal. We do it all the time. I used to do it as like a inpatient procedure where you're asleep, but now I actually kind of do it as an outpatient procedure because it literally takes like 3 minutes. The one thing is the injection is painful. So you're still injecting in the butt, in the muscle, and it feels like you have like a punch, like a bruise in the butt afterwards, but it works right away. And I'm able to feel the relaxation of the muscle. It goes from to relaxed in like
Wow.
10 seconds. And it does work very, very well. Only when that fails, and even I will try a second Botox injection about that 15% of the time before we do a cutting procedure like a sphincterotomy. But Botox works very, very well.
I I had to comment on this, but I just thought it was really funny. Your parents must be really happy, like hearing Botox, like, babe, I just a different place to place the Botox,
And they're like, well, and the number of times I've heard, well, if you have some extra Botox, can you bring it home and do this wrinkle and do this wrinkle? And but yeah, it is the same Botox, and in theory I could, but I'm not gonna inject somebody's face. I do know of colleagues who do though. But yeah, I actually had somebody ask me once, like this was a long time ago, whether I could inject their face after I do their butt, and or if they could get like the Botox points for because they usually do like facial plastic surgery for doing the butt. And I was like, yeah, I guess not. Why not? Like you're buying the Botox, so
That's so funny.
yeah. No, and it really works is the thing, and I and people are always surprised to hear it. And I, I should point out that it's Botox, but also like other like botulinum, toxins will work because there's like a couple of variations of it. Just
I guess still, I mean, this option is much better than the actual surgery, which is a lot more invasive.
exactly. If it were me, I would always try an injection first, and see if that works. And because it works so well, then if it still doesn't heal, we can do a cut. And I used to do the cuts a lot, and it works, but it's like a cut in your butt, and people have to heal from surgery.
Does Botox also count as a topical treatment, or like that's topical treatment is mainly the oils and ointments?
Topical is the ointments. Yeah. So Botox counts as an injection
Okay.
because it's intramuscular.
Okay. And then how effective are those topical treatments?
So topical treatments, like we've shown, it's about 70 to 80% effective, especially for non-chronic fissures. So chronicity is defined as technically greater than 6 weeks, although I will give people almost like, 3 to 6 months or so before we say it's completely chronic and you failed. And that's only because the regular treatment cycle with a topical compound will be about 8 weeks. So you really should do it for 2 full months before where you're like, hey, we failed the topical. Very rarely will I be like, oh, actually, after a month, this is horrible. You're not healing at all. We go straight to Botox. Most people will actually heal in 2 months with using the topicals.
Which is nice.
Yeah.
You mentioned about sitz bath earlier, but also like just like a warm compress and like a regular bath and also heating pads. So like when do you use sitz bath and how often should it be done?
If you're doing a sitz bath, and again, like sitz bath not in the plastic tub, but in a regular bathtub, it should be at least once or twice a day while you're having the fissure pain. It relaxes the muscle. Same with an electric heating pad. If you're sitting on it, once or twice a day. Most people, you're not going to be able to take a bath twice a day. Like, how nice would that be? So if you're showering in the morning, what you can also do is take like a shower head, just spray the warm water on your butt and hold it there for like 5 or 10 minutes and then just gently pat dry. The warm water will help. So say you're doing that in the morning and then at night when you're watching TV, you sit on an electric heating pad. That's like twice a day. And
that's
really
easy.
help. Yeah, like doable, rather than being like spend 20 minutes in the tub twice a day.
Yeah, I know we didn't prepare this question, but I figure that it's probably good to reiterate because it feels like both hemorrhoids and fissure, it's very preventable. So like, even if you have it, it's also good to prevent future development or, like a new fissures or a new recurrence.
Yes.
So like, the strategy would be don't sit for too long and eat enough fiber and reduce stress and drink water.
Drink water, regular to moderate, like a regular moderate activity. Try to get up once an hour and walk around. And I don't think we, talked about this last time, but since I was looking up, microbiome and like microplastics, since we're on Million Marker, there's is a lot of evidence right now that microplastics obviously alters the gut microbiome. And I think this is one of the reasons why I generally recommend probiotics. The science is out, like plus or minus on it, and there's a ton of like brands out there that don't have the right mixture of strains and don't have like enough variety of strains. But when you find one that works for you, probiotics have been shown to affect like frequency of bowel movement. So like having you go like once a day or once every 2 days versus like once every 5 days. And so there's really something in our gut microbiome that is telling our body how often like it should have that like MMC, like the gastric, the colon motility that's driving the colon motility.
And also, would you recommend getting a microbiome test before taking probiotics?
I think if you can, yes, but sometimes these are expensive, they're hard to find, they're not super accurate. If you can, I think it will help 100% because like where you're located, it's going to make a difference, and what you're eating and your environment will make a difference. But otherwise, I usually tell people try a variety. Like if some of the like big brands like Culturelle or Align aren't working for you, I always tell people try the Costco brand. It's cheap. You get like 60 or 120 of them. And it has like a really good variety of strains. That's the one that I take.
Cool. That's really good to know. But I guess there's also other like fermented food, right? Like kimchi, sauerkraut, like kefir, natto from like the Japanese soybean, and
100%. I love.
So there's like a variety of me too. Like a variety of things that people can try and then incorporating into your diet.
Yeah, and then so and then also like yogurts, and all of those are prebiotic foods, which, are helping to feed the good bacteria. But I think what the other thing I always tell patients that people don't realize is aside from the fermented foods, there's a lot of, foods that are prebiotics too. So like, things that are a little bit sugary, like the broccoli florets, for example, or like, green bananas. So I always tell people to eat a good mixture of like both green and ripe bananas because one of them actually helps better with constipation, but the other one is better for prebiotics. And this is like the same thing, like everything in moderation, like a good variety of foods as much as possible. And I love chicken fingers, but you can't just eat chicken fingers and fries the whole life.
Yes, absolutely. Okay, now so how can someone work with you?
Yeah, no, contact me on Instagram at Dr. Carmen Fong. My website is www.carmenfong.com. And then right now my book is on sale at online bookstores, www.constipationnation.com. I forget, did we send you a copy?
Not yet. But I would love one.
Oh yeah, no, let me have the publisher send you one. I totally forgot about that.
I'll DM you my address. Yes, we would. I would love it.
Yeah, no, of course.
It's a book I think everyone should read.
Yeah, and actually, since we last talked, I got a new copy of like "What Does Your Poop Tell You?" because I've just been collecting like poop books now.
That's awesome. That's so funny. Because after we talk, I like totally like I'm like, okay, that book is still sitting on my toilet, but yes, don't read it on your toilet.
Don't read it on your toilet.
I clearly remember I like loved that book. And that was the book I bought it for all my friends. And as I was just talking to my team the other day, I've been thinking about like what give it to people for their like Christmas present. Maybe it'll be just either Dr. Fong's book or like the, what does your book tell us?
There you go. No, no, I'm actually like very glad. Like so far the book's been well received, and I had one of my patients read it in the waiting room because I put a copy out there, and she's like, "This book sounds just like you. It's just like the way you talk." And I was like, "Yeah, no, it really is."
I wrote it. This
Yeah.
is awesome. Thank you so much.
No, thank you so much for meeting with me. I know you have a busy schedule.
Thank you. I know you too. And then we were able to reschedule it from the original time. So it's awesome.
Perfect.
Thank you.
Yeah, DM me your address so we can have them send you a book.
Okay. Talk to you soon. Thank you.
Thank you so much. Bye-bye.
Bye.